Thank the Chairman and Ranking Member. I appreciate the opportunity to be here. I serve on the Education Workforce Committee and spent 30-plus years practicing medicine. I've been through a health care reform in the state of Tennessee with a TennCare plan. And in my district of Tennessee, 3 out of 4 people want this bill overturned and replaced with common sense reforms. And in the last 2 years, I've had the privilege to serve with my good friend here, Rob Andrews, on the Health, Employment, Labor, and Pension Subcommittee, and we've held 2 hearings outside of Washington. That's a novel idea, to actually go out where the people are, talk to them about what they want and how it's going to affect business. And I've been to Evansville, Indiana, and Butler, Pennsylvania. Let me tell you what's going on in these businesses and in my own home community. We have a grocery store chain, 10,000 employees. I spoke to him on Friday. He said, Phil, he said, I have a lot of temporary employees that I hire because the grocery business, people get off from work in the afternoon. You've got to have temporary people to work when they come in. He said, I'm working them 3 hours a week. I'm going to have to cut those back to in the 20s because of what this will cost my business. I talked to a restaurant owner in a small community in my state that has 5 restaurants. He's going to close 2 of them. That's 300 jobs that go away. In my local community hospital, I've been there 35 years in that community. For the first time in 35 years, they've laid off 168 people and didn't fill 90 jobs because they're concerned, the uncertainty about this bill. And I also, Mr. Chairman, am, as a practicing physician, realize that I've read the 2,700-page bill, and already we have 13,000 pages of rules and regulations. And does anybody in this room believe that those 13,000 pages of rules and regulations are going to make it easier for me as a physician and easier for that patient to come in and see me? There is a much simpler and better way to do it. No question, all of my colleagues have said cost is a major issue, access is an issue, and liability. 2 of those 3 things we did not even touch on. That's the cost, because it's going up. We did nothing to bend the cost curve. And number 2, we did nothing for liability in this, which also drives the cost. So I'm here in support of this bill, and I appreciate the opportunity to speak.
Thank you very much, Mr. Rowe.